My former doctor intentionally misdiagnosed me and kept doubling down and gaslighting me about what my problems were till it was too late. Posted by you/Wanderlust Bimbo. This is the most painful story of my life, the one I am still in partial denial over, and the one that sent me to the ER over 50 times in 18 months. And it all started with an incorrect MRI interpretation that went far past the point of wrong. As a bit of backstory, I started having severe, debilitating migraines in the summer of 2021 after my second round of COVID. By the time I first saw this doctor, I had already tried and failed multiple treatments and medications. He ordered an MRI. It came back normal, but he diagnosed me with a rare condition called a CSF leak. I scheduled surgery, unaware that this wasn't true. I didn't have a leak. I only became worse after surgery. He actually admitted there wasn't a leak by that point, and my pain was repeatedly ignored and diminished, because I wasn't giving birth. The doctor ordered an angiogram. It was normal, but he diagnosed me again with intracranial hypertension and prescribed blood thinners. I became so sick I couldn't get out of bed, eat, or even properly use the bathroom. I never knew pain like this even existed. In between all of this, I began to go to the ER. Before that, I had never experienced such rude and sexist comments in my life, how I was being dramatic, or how I was a drug seeker, etc. The female medical staff was much kinder to me than the male doctors. I would eventually learn the truth, that I had been misdiagnosed twice and severely injured as a result. I also learned I'm not the first this doctor has hurt. He knew he was misdiagnosing me and did it anyway. I know how crazy that probably sounds. I learned via medical records he never thought I would get a hold of, as he blatantly refused to let me read them. I haven't been the same since that surgery. It's like a part of my soul has died and I'm now morbid and bitter. I never had anything he diagnosed me with, and the blood thinners were slowly killing me. The point of this story is to advocate for yourself as a patient for anything you might be struggling with. It could save your life. I hope no one here has ever experienced something similar. Update 2 months 2 weeks later. First, I want to say thank you to each and every one of you who offered support and advice, and to those who have shared their stories and experienced similar things or dealt with doctors minimizing your pain. I am truly, deeply sorry. This community is so amazing, and I couldn't be more appreciative of everyone here. I wanted to give an update on this because it's something that still weighs on me every single day. I have some positive news. I believe I have finally found the right attorney. She will not only help me, but she also wants to look into having my former doctor's license revoked through the state medical board. I have heard more and more about how this doctor does this to other patients. I've even spoken to a few of them and feel so awful knowing they, too, have suffered at the hands of a man wanting to be like Dr. Death. For a bit of bittersweet news, I recently did a test and learned how bad the nerve damage is. I'm looking at having nerve decompression surgery in the head/skull/brain to help alleviate symptoms. It's not too invasive, but it's a hard few weeks of recovery in a hospital, and I have a lot of allergies to medications, but I am hoping for the best. Thank you so much to everyone here, you all are wonderful. Second update 3 weeks later. I caught wind of my original post and first update being shared in another sub. I truly wasn't expecting that. Most of the comments were very supportive, but I want to address some of the issues that were brought up. My story isn't fake. It never was fake. It never will be fake. I wish it was. This story was not fabricated due to my alleged hatred of men, as a few individuals commented. I don't hate men. I do hate some of their behaviors, but I would fully hope someone would call me out if I acted that way. It's a mutual feeling. I wouldn't expect someone to put up with me acting like a prick. One of the things that was brought up was my medical records and my diagnoses. I'll try to be as concise as possible. My medical records contain damning information. 2 of my correct diagnoses are recorded in these records. However, the verbal diagnoses and treatment plans, both on paper and verbally, were completely different. I was treated for issues I did not have. Yes, I do know that blood thinners do not treat intracranial hypertension, it's usually Diamox, but blood thinners are what I was prescribed. In other words, my former doctor knew he was misdiagnosing me. He was fully aware. He is not stupid. He is likely a narcissist. I developed hemiplegia with migraines at the beginning of this year. I do not know why. And I may never know. The cluster headaches, too, I do not know what caused them. There is ambiguity in some of this information because it is still ongoing. There is still more to be uncovered. I am heavily considering nerve decompression surgery, or even removal of the occipital nerves. I found stories of other patients, both men and women, as a few individuals assumed that I was only recounting stories from women, online, and even through Reddit. These stories will not be involved in my lawsuit. I found them to see if there was a pattern of negligence on my former doctor's part, and this proved to be correct. This doctor has harmed both men and women. I do not believe he was only harming women. Finally, onto the small update. The case is underway. It is very unlikely to go to trial. I have too much on him for any sort of major defense. I'm hopeful, but this entire thing is so emotional for me. It's hurtful to know people assume I am lying about my story, but it's Reddit. These people don't know me, and I'm not going to spend hours upon hours trying to convince strangers of my truth. They weren't there. Thank you to everyone who has offered kindness and support. I really appreciate it. I will update one final time when my case is settled. Until then, I'm just trying to heal psychologically and physically. Third update 5 months later. Hi everyone. I just wanted to share this without it becoming a long wall of text. I was admitted to the hospital last night after what I believe to be a 7-day and counting migraine. It took me making a scene and probably coming off as a bit ridiculous to have anyone take me seriously enough. Usually, when I visit the emergency room, I get strange looks and oftentimes hurtful comments. Maybe it's because migraines are invisible to most onlookers, but I digress. After what turned into a 24-hour-long visit with multiple doctors, imaging, rounds of Toradol infusions, and even lidocaine injections to the skull, I spoke with a migraine specialist. This is a first for me. Until today, I had never met someone who specializes in them. The discussion was long, but for the first time in what feels like years, I was heard. My former doctor caused a nerve disorder, something that is rare and, if left untreated, can become excruciating. I have scar tissue running along my occipital nerves and am now going to undergo a specialized surgery that few doctors recommend and even fewer perform. The healing time from the procedure is 3 years. I will be 27 years old by that time, having spent a total of 6 years trying to understand and identify what my former doctor truly caused. This post is not intended to paint me as a victim. It stands again as a cautionary note to anyone, especially women: if something seems wrong with a medical treatment plan put in place for you, always seek other opinions. Don't end up in the same position I am in. I will experience complications for the rest of my life because I believed someone who deliberately hurts his patients for money and for control. Fourth update 6 days later. To everyone who sent kind messages throughout my storyline updates, and to everyone who commented advice, similar experiences, and words of encouragement alongside words of sorrow, thank you from the bottom of my heart. This community is truly wonderful, and I am so grateful for everyone here. I didn't think I would be posting an update like this so soon. I wish I could say this update is positive, but unfortunately, it isn't. I'll start off by confirming that everything I have said about this doctor is true. My story is true, backed up by 10+ inches of concrete, concise evidence. The other testimonies about him are true. The fact that others have been harmed by this doctor is horrifying. I cannot tell you all how many times I've broken down sobbing because someone else reached out to me with a story like mine. The attorney I believed was in the process of helping me, he lied to me too. I suspect he knows this doctor and is perhaps friends with him. I believe this doctor is paying people off to avoid legal consequences. I have never been told I didn't have a case, but no one has been willing to initiate a lawsuit against this single doctor. Other doctors face lawsuits that I can find through public records. Not this one. Not once have I found anything, other than review after review detailing the horrors this man has inflicted on others. It started in late 2020, with a woman who likely tried to sue and was denied justice. She was left with brain damage and underwent specialized brain recovery treatments as a consequence of this man. The reviews are still stacking upon each other. Some are so frightening, I again start crying. My diagnosis is final, 3 years after the surgery that nearly killed me. I still have residual effects from the blood thinners I was lied to about and ordered to take. I have nightmares depicting this man chaining me to an operating table to finish the job he started. I cannot visit a doctor's office without a panic attack. I visited the ER over 70 times as a result of the damage. My veins are shot, unable to give blood without collapsing, stubborn during 4 treatments that burn when pushed into the line. I no longer fear needles, but the pokes are becoming more and more painful, scar tissue clouding the veins to protect them. There are days where all I do is ruminate and cry. The pain I will experience forever will serve as a reminder that I may never truly be free from the lies I was told, the 30+ medications I tried and failed, the weight gain I experienced from all the steroids and increased hunger. I will be taking a break from Reddit. I was approved for disability and need time to reflect and to heal emotionally. The scars will always remain. This upcoming surgery scares me, but I have hope, even when I shouldn't. This doctor still practices, still harms. Justice is a thing rarely seen in today's world. But I am far from finished. I will not stop until this man is out of practice. My anger toward him is far too strong for me to give up. I will find a way to make it happen. For myself, and for everyone else he has harmed. I'm not done fighting. Thank you all for your help and support. Editor's note. Ops stated in the title of their last update that it was the final update and at some point deleted their account afterwards. In the comments from the Best of Redditor Updates post, many people speculate that Op was not mentally well, though Op was being serious, from their perspective, about the problems they were facing. Here is a comment from someone who dug through Op's post history. Read through Op's comment and post history, and she really needs her mental health treated as well. She's a very unreliable narrator. Her overall experience seems to be consistent with how the doctor/surgeon does operate, but she's so paranoid and so prone to exaggeration, it becomes difficult to sort the facts from the BS. Maybe that's why she's having difficulty suing? She went to a doctor about a sinus infection and ended up seeing this doctor for surgery to fix a CSF leak. As someone who had a 4-month-long chronic sinus infection that only cleared up after heavy doses of antibiotics and surgery on my sinuses with a turbinates ablation, I don't know how or why you'd go from sinus infection to brain surgery when there are other types of surgery for that which are right there and make more sense. How does insurance even cover that? This is America we're talking about. Surgeons can diagnose you with whatever, but that surgery doesn't happen unless the insurance company thinks it's reasonable. Others in the CSF leak sub seem to substantiate part of her story about the doctor, name mentioned in her comments, misdiagnosing people to do unnecessary surgery. And honestly, that's not unheard of. ProPublica did an article last year about a children's oncologist in Montana who was performing unnecessary treatment and got away with it because he was so beloved and trusted that his nurses just didn't question him when he told them they were wrong. He gaslit an entire oncology ward's treatment team. Where things fall apart for Op is that her story seems to be the worst of all possible outcomes by orders of magnitude, and her experience, that the surgeon conspired with the radiologist and nurses, doesn't seem to mesh with other people's experience with the surgeon doing malpractice. In the other cases, he's overriding the opinions of the other medical professionals, similar to how the doctor in the article I mentioned operates. She has 4 kinds of migraines now, her veins are all unusable, every lawyer is against her, etc. There's serious paranoia, some of which is explained by trauma, but not all of it. I'm not any sort of medical professional, so I won't try to even guess what's wrong with Op beyond trauma/PTSD from medical malpractice. I just hope she gets the mental health treatment she needs.